Let's go ahead and talk about those, because there are a number of symptoms that we need to look at. And the first one is that heavier, prolonged menstrual bleeding that comes in there. But let's go ahead and look at the graphic, and if you could give us an idea here of what we're seeing.
So basically, when we say heavier, prolonged menstrual bleeding, it's that goes beyond the 8 days, that becomes more frequent during the month, that you actually are bleeding. Some of my patients come to me and tell me, look, I'm having a period twice a month. That is not normal. Even if it was normal for you for the last year or so, it is not normal. That needs to be evaluated. This pain, pressure, the fullness in the pelvis, again, this is likening to that of fibroids that are big enough will feel like you're carrying a baby. And for those who haven't carried a baby, will feel like there's pressure in that area where there wasn't before. Frequent urination or constipation. These fibroids, when they're large enough, are pressing on your bladder, as I spoke a little bit before, can even make you have some incontinence. And they also press on the bowel, and that really, in the bladder and the bowel, they cause problems of incontinence and pressure. During intercourse, this is a large uterus, it's behind it. So basically during intercourse, there's pressure on intercourse and pain. That should not be normal and should warrant an evaluation. And then if you can feel your abdomen to be enlarged, you can feel that there's a mass, absolutely that needs to be evaluated.
Can you find the fibroids in a normal pelvic exam? Find them all?
No, and that's even for us gynecologists that we do this many times a day. Sometimes the fibroids, as we saw on that graphic before, can be inside the uterus, can cause a lot of bleeding and pain, but you still have a normal-sized uterus. You should, if they're large enough, feel that there's a problem as a gynecologist and refer your patient for a pelvic ultrasound.